This is a special test for the tensor fasciolata to see if it's tight. It's called the Ober test. The bottom lower extremity is going to be in a position of flexion so that she kind of stabilizes herself here with this leg. For the Ober, you can either test with the knee extended or in about 90 degrees of flexion. The original Ober test is with the knee bent. Sort of the modified Ober now is with the knee extended. I'll show you both versions, but basically there's a bit more stretch on the tensor fasciolata with the knee in extension. So we'll start with that position. So what you're going to do is take the lower extremity into abduction, extension. This allows the tensor fasciolata to come over the top of the greater trochanter of the femur, and then we're going to lower the leg slowly. If she had a tight TFL, this would be a positive test, sort of the leg staying in this position. The negative test would be that the lower extremity can lower all the way down. So do that test with the knee in flexion. So we're going to go into abduction and extension. This hand is really stabilizing to make sure that pelvis does not fall backwards for both knee straight and knee flex. The next test we're going to do is the Thomas test. This one tests for tightness either in the iliopsoas or in the rectus femoris. So what you're going to have your patient do is sit sort of close to the edge because you need to make sure the knees are free. Then you're going to have your patient grab both legs behind the knee and tip backwards. Okay? You want to make sure that you kind of stabilize behind their back and help assist them as they go back down. Then I'm going to have her hold on to this leg, and this is actually going to be my test leg. What this will do is help keep the pelvis in a posterior pelvic tilt, which will put some stretch on the iliopsoas and the rectus femoris as it comes down. So this is our test leg, and all we're going to do is have the patient gently lower the leg to the table. Now a negative test would be that she could go all the way down to the table with her knee sort of in a bent position. That's a negative test. If for some reason she had some tightness, a positive test would look more like this. Now we know something's tight, but we're not sure which one quite yet. It could be the rectus femoris or it could be the iliopsoas. So what we're going to do is extend the knee, and that takes the rectus femoris off. So if we take the rectus femoris off and she lowers her leg down, we actually know that that was the tight one. So by taking it off, she's able to come all the way down to the table. If we bend her knee again, so she's sort of in this position, this is a positive test, but again, we're not sure which one is tight. If we straighten it out and nothing happens, then we know we loosened up the rectus femoris, so that one wasn't tight, but the iliopsoas was tight because it's still holding her in this position. The next test is a test for piriformis tightness. So you're going to have your patient really close to you on the edge of the table. This leg is going to be, again, kind of bent so that it stabilizes the patient. This is the leg that we're testing and the side that we're testing the piriformis on. You're going to bring the lower extremity into about 60 degrees of flexion, and my pressure is just going to be straight down. We want her foot still sort of on the table and stabilized. My pressure is going to be straight down to the floor with her leg, and basically I'm just stretching that piriformis muscle. A positive test would be pain or the patient feeling sort of a stretching in that area. The next test that we're going to do is called a Trendelenburg test. And what we're going to do is have the patient stand in single leg stance on one leg. So you can put all your weight on this leg for me. And what we're looking at is this, so we're testing the stance leg, but we're looking at the pelvis on the opposite side to see what it does. Currently she has a negative Trendelenburg test, there's not a problem. If she had weakness in her abductors on this side, they wouldn't be able to hold her pelvis, and so her pelvis would kind of dump out on that side, or she'd fall over. And this would be a positive Trendelenburg if her pelvis drops on the opposite side. But again, the stance leg is the leg we're testing, and we're seeing what her pelvis does, and can these muscles hold her pelvis level, or are they too weak and they're going to allow her pelvis to sort of drop out on that side. The next test is a very general test for the hip to just sort of see if there's something going on. This test is called the Faber test, and Faber means flexion, abduction, and external rotation. So we're going to take the patient's lower extremity and place it in flexion, abduction, and external rotation. Her ankle should be just above the knee on the other side. What we're looking for, we may put a little pressure down. What we're looking for is that the legs are sort of symmetrical and the pelvis is sort of symmetrical. This would be a negative test. A positive test would be that her leg would remain above her other leg on this side. So what may be positive in this position, again, we're not sure exactly, so we're going to have to do a few more tests, but we're going to do this general test first to kind of see what it could be. So it may be, you can bring your leg down. It may be that there's some hip joint dysfunction, it may be that there's some iliopsoas spasm, or it could be an SI joint problem, and we'll have to figure that out with more special tests. Next, we're going to do the Faber's test, which is flexion, adduction, and internal rotation. So we're going to start the patient's leg in sort of a position of like the Faber, which is external rotation and abduction. And what we're doing is we're taking the head of the femur and we're sort of grinding it around in the acetabulum to see if there's anything going on there. So we're looking for some labral problems, we're looking for some superior impingement problems, and some iliopsoas tendinitis in there. So I'm going to take her leg and go into a position of extension, abduction, and internal rotation. And again, I'm kind of just grinding the femur in the acetabulum. So a positive test would be pain, it might be clicking, or reproduction of symptoms. And again, a positive test may be superior impingement syndrome and anterior labral. Now we're going to measure leg length discrepancy. The first thing you need to do is somehow set the pelvis. So we want to make sure that the pelvis is level and not that the pelvis is off, which makes the legs look like they're different lengths. So the first thing I'm going to do is just have her do a bridge, which is where she lifts her rear end up off the table a bit and then sets it back down. And now can you slowly lower both legs straight for me? One at a time. Yeah, that's okay. So for this particular test, the other thing you can do is just give a little traction. So taking both of your hands and kind of give a little traction, again, just to make sure that the pelvis is level. And what you're going to do is take your thumbs and put them on the medial malleoli, and you're just kind of looking to see first if you feel like there's a discrepancy. If there's no discrepancy between where your thumbs are, then you really don't need to measure. But if you find that there is some big discrepancy, let's pretend, then we're going to measure. Ooh, that looks very different, so I'm going to measure those. What we're going to do is use centimeters, and we're going to measure from her ASIS down to her medial malleoli on both sides. And what sometimes, if you're having trouble finding the ASIS, I may ask the patient, can you just point to your hip bones for me? And that may help you kind of find them. So I'm going to put 0 at the ASIS. I'm going to measure down to her medial malleoli in centimeters, and she is at 89.5 on this side, and then I'll measure the other side. Can you point to your hip bone again on that side? And she's at 90 on this side. So again, we messed her up slightly. She's probably normal. But when you take a look, so for a positive test, it would be greater than 1 centimeter difference side to side. The other thing to notice is that if you have a patient who may be pregnant or has a rather large abdomen, you can do ASIS to lateral malleoli. You just need to document that you did that slightly different. The next test we're going to do is the 90-90 straight leg raise test, looking for hamstring tightness. So I'm going to have the patient bend both knees, hips and knees to 90. Good. And then can you hold behind your legs just to stabilize there? Yeah. What we're going to do is have her extend, and I'm going to have you come just slightly, there we go. So now our femur is right at 90 degrees of hip flexion, and then what I want her to do is extend this leg. So this is our test leg. And what we're going to do is take our goniometer and measure the lack of extension from 0. So I'm going to measure the knee just like I do for regular goniometry. And I'm going to say, okay, so when I look at this, she's actually lacking 45 degrees from 0. So this would be a positive 90-90 straight leg raise test because she's not at 0. So I'm going to cheat, she does have tight hamstrings. But a negative test would be where she could fully extend her leg or get within 20 degrees from full extension of her knee. The next test we're going to do is called the hip scouring test. So we're going to take the patient into a position of hip flexion, okay? And then we want to take pressure down into the joint, because basically with hip scouring what we're doing is taking the head of the femur and kind of rubbing it around in the acetabulum to see if we get any catches or any problems there in the acetabulum. So we're kind of looking for a labral problem, maybe some arthritis or some other type of joint problems itself. So my pressure is going to be down into the hip joint itself. I'm going to take the patient into adduction and external rotation of the femur, and then I'm just going to kind of rub it around in there to see if I can get anything picking up. So a negative test would be nothing, the patient is fine and has no problems. A positive test would be pain or clicking or catching as you're moving the head of the femur in the acetabulum.